Okay, welcome back. This is part 3 of immunodeficiency disorders. Today we'll talk about combined B and T cell disorders. Let's dive into it. Let's start off by talking about severe immunodeficiency disorders. So, what is the mechanism? There's two types. The first one is defective IL-2 receptor gamma chain, and which is X-linked recessive. And the second type is ADA deficiency, which is autosomal recessive. Clinical findings: you can have recurrent severe infections, diarrhea, and failure to thrive. It can lead to early death as well. How do you diagnose this? So you diagnose this by decreased T cells and genetic defect. What are the treatments? So one, you can do IV immunoglobulin, prophylaxis, and hormone replacement or enzyme replacement. Okay. The second one is ataxia telangiectasia, which is autosomal recessive defect in DNA double strand break repair. So, what is a clinical finding? So, you get progressive cerebellar ataxia and atrophy. And you can also get telangiectasia. And then you can diagnose this by seeing decreased IgA, IgM, and IgG. And you can also see increased AFP as well. Treatment is just supportive with IV immunoglobulin and treat the infections. Third one is Wiskott-Aldrich syndrome, which is an X-linked disorder of WASP gene. And then you'll see recurrent bacterial, viral, and fungal infections. You can also see thrombocytopenia, so low platelets, and eczema. And you'll see increased risk of malignancy and autoimmune disease. And how do you diagnose it? You can diagnose it with increased IgA and IgE. Treatment is IV immunoglobulin and antibiotics, and platelet transfusion if it's severe bleeding. Okay. Last one is hyper IgM syndrome. So this is defective class switching. So you'll have increased IgM and everything else is low. And this is due to CD40 ligand deficiency. You'll have recurrent sinopulmonary and GI infection. So you have increased IgM and decrease IgG, IgA, IgE, etc. And treatment is IV immunoglobulin and prophylactic antibiotics. Okay, and that's it for today's video. I'll see you on the last part of immunodeficiency disorders.